Hello, everyone. Good evening. So, all set? Hello, everyone. Good evening. We are having just a tech team just to check dermatology as a career. Are we going to have it come as a scroller on the top throughout the session? Tech team, are we going to have that as a scroller on the top? So, yes, turns out we are going to have it. So, that's what I was checking. Anyway, so good evening, everyone. Here we are discussing if you can build a career in dermatology. First of all, congratulations to you all who are watching the video because you have successfully given a very difficult exam. You have got a rank and you are at that point where you are considering picking up a branch, deciding whether it is good for you or not. So once we reach that point, that is a very good time. Yes, you will say, ma'am, but we are very confused. This is a very difficult time. We have to make choices. We don't know what to do, how to do. Yes, confusion. Every point is going to be difficult. Every phase in your life will have its challenges. But isn't this a good challenge to have? That you are deciding which branch to take. At least you have gotten done with the exam, you've got the rank, and even after getting the rank, counseling is happening after so long. So, yes, counseling is about to begin. That's a good thing for all of us here, isn't it? Isn't it? So, yes, now we have come to this point where we are deciding whether or not to take up dermatology. Any doubts from you all? Any of you there who are wishing to take up dermatology? Any of you wishing to take up dermatology? Any doubts that you have? So, if not, let me begin with my journey of life. So when I was in school, I was always told you have to be a doctor. You know, everybody in my family wanted to be a doctor, but ended up being engineers, like is the case. So I was the one, that one beacon of hope in the family that she'd become a doctor. So I was told this since the beginning. I studied very hard throughout school, very hard throughout 11th and 12th PMT. Ended up getting a decent under 100 rank in Delhi. This is way back 2006. Yes, 2006 batch MBBS I am. So this was a Delhi PMT rank 99, got Lady Harding Medical College, Delhi, studied very hard throughout MBBS. Yes, I did study more than I had fun. Something I regret now, but studied very hard throughout MBBS to get an All India rank 264 in the All India PG. got University College of Medical Sciences Dermatology, did my senior residency from Maulana Azad Medical College. So basically, I have bowed on all three colleges in Delhi University at that time. So this was my journey. Did I always wanted to become a dermatologist? I don't know, but I ended up working a bit hard there also. Did all these courses. I'm still doing, I'm still studying, I'm still organizing, I'm still administering a lot of conferences, still, journey of learning is continuing. See, all of this. So it didn't end with just doing a residency. It just never ends with doing senior residency. You have to do a little more than that because you have to satisfy that kida in your life. So all this I did, and what am I now? I do have my clinics. I am working as a dermatologist. I am teaching as a faculty for the entrance exams and doing every other role that life demands of you, that a patient demands of you, that this journey of life calls from you. So this is how I became what I am today. Can I say I'm happy? Yes. There are good days, there are bad days, there are days I love being a dermatologist. There are days I wonder, why did I pick up this branch? Yes, you do get these questions. I was 2012, I picked up dermatology. So till now, I do have this question sometime in my mind. Why did I pick up dermatology? I could have done better in medicine, or I could have done better in some other branch. So having a branch is not like a one-time decision, and you can always be happy in that. There are questions in your mind when you are choosing. There are questions in your mind during that journey, and even later on, you may have some niggling thoughts in your mind. So that's all a part and parcel of life. When you get to choosing a life partner, when you love someone wholeheartedly, or you get into an arranged marriage, you marry that person thinking you're going to spend your life happily ever after with them. But there are your good days and bad days in a wedding. There are days you love your partner, there are days you hate your partner. There are days you wonder, why did you marry this person, or why are you a boyfriend or a girlfriend with this person? So there are good days, there are bad days. Similarly, with your branch also, there might be some days. So it's a very, very, very important decision of your life, what to do, what branch to pick up. Because a partner you may change, but a branch you can never change. You are married to that branch for life. So this has to be a very informed decision. This has to be a decision that you take very, very carefully, considering every possible outcome and your choice. Now, for all of those who are thinking of dermatology, please introspect. Look into your mind. Why are you even thinking? Why are you watching this video? Is dermatology one of the many options for you? कि कुछ तो लेना है, something I have to do. So maybe dermatology, one out of them. Or are you someone who genuinely wants to be a dermatologist? You've seen a dermatologist around you. You have sometimes been treated for a skin disease. You want to be like the person who was treating you. So you genuinely want this branch, or someone in your family is a dermatologist. You have to join the family clinic. You have a family hospital which you have to join. They need a dermatologist. So what is your want? What is the reason you are picking up dermatology? That is something you have to know. Or maybe quite simply, you are a topper, or you are a topper and you've been told that top ranks tend to pick up dermatology. So you have to consider dermatology. Even in the last year's counseling, amongst the top 5 or 6 branches, dermatology was there. There was radio, there was medicine, peds, and then there was derma. Even last year's NEET PG counseling. So have you been told that you are a topper? Oh, you have to go for derma, radio, medicine. This is what you have to consider. Or you're following the herd mentality. Every person who's a topper is picking up dermatology. It's a very glamorous branch. You see people on social media becoming influencers. You see people opening very fancy clinics. Oh, you want that in your life. So you don't, have any of your personal liking, but you are following the herd. You're having that herd mentality. Are you one of those? Or you are just someone who doesn't have much in life, he just wants a chill branch or she wants a chill branch, you just want a work life balance, kuch bhi kara do. Give me any branch. Just give me a branch that is chill, that gives me decent money, and that gives me a work life balance. What is your reason for watching this video? Why are you considering dermatology? That is a question I want you to ask yourself before we proceed forward. Because everything, how you see, how you perceive, how you make out of what I am telling you, will depend upon these factors. Okay, so first, before moving forward, try to introspect this. Now, what is dermatology? Dermatology is a medical branch. It comes under the allied sciences of medicine. A good chunk of dermatology is clinical. It is medical specialty. You see a patient, you write the medicines, you send them away. Now, a lot of surgical procedures also we do. Simple surgical procedures, mole removal, scar removal. There are so many benign appendigeal tumors. There are malignancies. There are so many dermatosurgical procedures that we do, which include your traditional instruments. Then you have lasers, you have aesthetic dermatology. It is a vast pool now, you don't see it as just a clinical dermatology branch now. There are multiple things that you can do in a dermatology setup. Someone can choose to open just a clinical dermatology setup. There are people who are opening only aesthetic dermatology setups, and there are people who are doing pure dermatosurgeries also. So we have multiple things that come in dermatology. Now, why would you pick up dermatology? What are the pros? Let me tell you the good points first. You always want to hear the good news first. So let me tell you the good points. Why should you think of derma? First of all, this is a very specialized branch. That's a very important and a relevant point for a lot of us who are fed up of studying for the entrance exams, who are fed up of having their life depend upon entrance exams. So sometimes have nothing else in your checklist, but you want an N branch. So amongst the good clinical branches, amongst the top branches, what is important is that dermatology is an N branch. Once you do MD dermatology, there is absolutely no requirement. Rather, we don't even have any super specialties. There are no exams. There is nothing. No patient is expecting to see anything more on your board other than MBBS and MD. That's it. That's all that they want. So this is a highly specialized branch. There is no super specialty required. There are no exams that you have to give after this. And the kind of work that we do, that's a very niche work. All branches have their niche works. Derma, very niche. Only we know our subject. There is actually no one who knows dermatology. Yes, they may give you triple combination creams, they may give you steroid, antibiotic, antifungal combo, but does anyone else know dermatology? Not really. This is a niche work that we are doing. And this is one of those branches where you can work less and you can earn much more. So you have a good earning potential. Though I would not want you to think of dermatology just for earning money. Anyone and everyone can earn money in today's time. You don't really have to be even a doctor to earn money. So money is not your consideration, but yes, you should know that dermatology gives you good money. But there are buts. I'll tell you the buts when we come to it. See, it's an N branch. You don't need to do anything. But still, if you want to hone your skills, you want to learn new skills, you want to learn something more than what has been taught in your residency, we have excellent short-term, long-term fellowships ranging from 1 week to 1 month to 3 months, 6 months, 1 year, 2 year. There are multiple duration fellowships, paid, unpaid. Some fellowships you win, they're awarded to you, you are chosen amongst all the applications. Some fellowships you just have to pay money, you can join them. Both of these give you a good level of earning that you have. You can subspecialize in pediatric dermatology. That's a very upcoming branch, especially in the metros, where children and their parents would want to go to a super specialist. You get that feeling for everything you're going to a super specialist. So maybe for a child also you want to go to a super specialist in dermatology. These are pediatric dermatologists. Then hair transplant surgeons. extremely in demand, extreme amount of earning. Yes, there is some competition from technicians, there is a competition from non-dermats doing these procedures, but we are not going there right now. We are going into what we get. There are fellowships and there are special dermatosurgeons across the country. If I know there is a difficult surgery, I may or may not be able to do it. I will know that one person in the area, in the state to which I can refer to. So there are people who are known for their dermatosurgical skills. And then aesthetic dermatology, oh, upcoming anywhere, everywhere. You keep seeing these anti-aging clinics, you keep seeing these aesthetic clinics. You can do fellowships in aesthetic dermatology, learn your skills, be an expert in that. So these are the fellowships that you can do. You can make one of those your niches when you are starting your practice. So this is about what can be done. Now, why dermatology? Look at the clinical part of it. This is a medicine branch. Each and every person on earth is your patient. It's not pediatrics that you will only get children. It's not obs gynae that you will only get women. It is not one of those branches where you only have a specific set of patients as your patient pool. Here, each and every patient of each and every size, of gender, of age is your patient, starting from a neonate to an elderly, a girl, a boy, any other person is your patient pool. Apart from that, there are a lot of dermatological comorbidities in patients who are sick, who may be transplant patients, immunosuppressed patients, HIV patients, then chronic kidney disease, diabetes, hypertension, the drugs that they are taking. All of these tend to have dermatological associations. So all of these patients, other than your routine patients, are also your patients. So you have a very wide diverse pool. Then this is a branch where patient interaction is much more, because most of our diseases are chronic. Patients tend to come to you for a long time. They are your almost lifelong follow-ups. I have patients who are my follow-ups for years, 6 years, 7 years since I've been in practice. They've been coming. So you tend to develop a personal rapport with these patients. You have to explain all the things to them. Tender loving care is hand-holding, is a very important part of dermatology. So you tend to interact, you tend to talk more with the patient. So if you are someone who tends to talk, who likes to talk, who wants a clinical branch because you like patient interaction, dermatology is for you. Now, coming to the diagnostics, this is a visual branch. You look at the lesion and you know the diagnosis. When I was doing my residency, I was doing my SRship. I was in a government college. As you see, we had an OPD of 200 per room. So we had to finish 200 patients in 3 hours, 4 hours. We didn't really have a lot of time when you're seeing patients. So the minute patient walks the room, if there is something on the face, we would know what they have, or they show us the lesion. Acha dikhao, ho gaya, we know the diagnosis, we'll write and we'll have to go. So you want to talk more to the patient, you talk more to the patient, but you want to talk less to the patient, you can talk very less also. This is a visual branch. Instant diagnosis, instant treatment. Many a times we don't need any investigations. We hardly get biopsies done, especially in private practice, because most of the times we tend to make a diagnosis. So this is a very gratifying branch intellectually. If you're someone who's smart, who likes to read medicine, you can read up so many diseases, you know what they look like, you look at the patient, you make the diagnosis. So intellectually very stimulating, instant. You don't have to wait for any chest x-rays, blood tests, you don't have to call the patient again. Instant diagnosis, very few reliance on investigations. That's a very important part of the clinical aspects of dermatology. Procedures, I've already told you, are multiple. There are dermatosurgical procedures, there are lasers, injectables, Botox, fillers, PRPs, PDRNs. Oh, there are plenty of injectables that we can do for the patients. Anti-aging is a superbly upcoming market on its own. And when I say anti-aging, when I say aesthetic dermatology, I am not limiting myself to those who are 40-year-olds, 50-year-olds. I have girls, boys as young as 25 years coming to me for treatment of a simple frown on their forehead. Doc, when I'm in my office, I don't like this frown. It tends to make me look angry and stressed all the time. Can you please correct it? Oh, yes, I can correct it. I have the means. Then 30-year-old coming for fillers, coming for threads, they don't like the slight sagging on their face. So aesthetic dermatology is a very upcoming branch. People have the awareness, people have the resources, they are earning, treatments are getting cheaper because they are more widely available. So this is something that is a very, very upcoming branch in, you know, dermatology, very upcoming. Now, apart from that, you have cryosculpting, you have fat loss machines, you have body shaping machines, you have different kind of machines to add to your aesthetic dermatology armamentarium. Very, very relevant. Jobs. Once you've done dermatology, what are your future options? You can take an institutional job. You can join a government medical college, private medical college. You can just join as a specialist in a government hospital, which may be a non-teaching hospital. But yes, you do have these kind of jobs available, although I would say these are few, because generally dermatology departments are smaller departments, so people remain in their jobs for a long time. Vacancies are far and few. These government jobs and private medical jobs are not as much in number, but with so many colleges coming up, these jobs will increase in, future. But yes, number of people in dermatology will also increase. So this is going to be a pain point in future getting jobs. There are a few research jobs available, especially the premier institutes. There are corporate hospitals who are giving jobs, but unlike the other core clinics, there are some issues with dermatology jobs there. If you don't want to join a corporate, you can join an aesthetic clinic. You have Kaya, VLCC, Clinic Dermatech, then so many other cosmetic clinics in Gurgaon, Noida, anywhere, everywhere in the metros in Mumbai, Bangalore, Hyderabad, Chennai. There are multiple aesthetic chains which are sprouting up clinics across the country. They need dermatologists full time, part time. You have those jobs available. You can move to international locations. You can move to the Middle East. Oh, it's an open area for dermatologists. Plenty of good paying jobs. You can open your private clinic, which is mostly done by most of the people. Very, very good life you have if your private clinic runs well. So these are the career options in dermatology. Yes, you may or may not do a fellowship, but you can always consider these as your career options. How will your life be? Your life is going to be easy, it's going to be cool, and it is going to be a low stress life because of the branch that you've chosen. We tend to have fixed working hours, we tend to have patients who are not very sick, who are not dying, there is a low mortality, you don't have to run to save lives of patients. So this is generally a low stress life that you have. Excellent earning potential. Sky is the limit if your clinic picks up. Not so much with the fixed pay jobs, but in your clinic, sky is the limit. You have fixed working hours wherever you are working, in a corporate setup, in a government setup, in your private setup, aesthetic clinics, everywhere it's a fixed pay job. There is no patient who is suddenly going to get sick at the end of the day and your shift or your job is closing at 4 p.m. You'll have to stay till 6 or 7 p.m. managing the patient. No, nothing of that sort is happening. No. So you will generally have fixed working hours. No nights, no emergencies. In residency, you may have nights because some of the government hospitals, a few other private, colleges may have inpatients. So though you may have night duties in your residency, but you don't have any nights once you finish with your residency. That's a very, very important point for your future, especially females. I am not having any gender bias here. I would be the first one to say, okay, 9 to 4, let a woman go. No, it's not about that. But having no nights is very important, especially if you have a partner who has an emergency based branch. So you at least know that one person is going to be home. Then you may be just someone who doesn't want to do night duties in your life. You're fed up of doing that in your internship or your JRship. You don't want that in your future. So dermatology is a branch for you. It's a clinical branch. It is a branch without any night duties. Then even if you are a duty in your residency or later in your life, there are hardly any emergencies. Yes, some patients may have acute urticaria. Some patients may have herpes zoster, which is intensely painful. Some patients may have drug eruptions. Those are the only emergencies that we tend to have on, a larger routine basis. So even in your residency, no emergencies. Even later in your life, no emergencies. No patient is going to call you in the night asking you कि मुझे ये हो गया बताओ, give me a medicine. No, generally does not happen. I keep my phone away at 8 o'clock. I don't take any calls after 8 o'clock. I know that nothing is happening. But can the other core clinical branches do it? Generally not, because they have patients who may be in a life threatening condition, who may be sick, who may require constant monitoring and calls. That does not happen with me. On a Sunday, if I don't want to open my clinic, I don't open my clinic on a Sunday. Till now, so many years into practice, I don't open my clinic on Sunday. My choice. I want a weekend, I want a weekend. So I don't work on Sundays. Most of the patients who walk into my clinic, these are elective patients. Elective patients means they tend to have problems that can wait for them to schedule a visit. So when you are having your clinic, it is very, very easy to have a flexibility in your schedule. That's, you don't consider it to be important at the age of 24, 25, 26 when you are choosing a branch, but you see yourself 10 years down the line, 20 years down the line. To have that kind of flexibility is a privilege. What you call in the cool language, that's a flex in life. So yes, having that flexibility in your clinic is the ultimate flex for you. You can choose your clinic timings, you can opt not to work on a certain day, you can schedule your patients on a daily basis. As I told you, most of them are elective, most of them tend to call for appointments. So your patients come in, you know that they are coming in. And if you don't want them to come, you can just tell on phone, no, doctor is not available, they'll be available tomorrow. They'll be more than happy to come tomorrow. There is nothing which is, you know, again, I would say life threatening or stressful for the patient also. They can schedule their visit once the doctor is back. You can take as many holidays as you want. Yes, when you can schedule your patients, take as many holidays as you want. Nobody's questioning you कि patient sick है, doctor छुट्टी पे कैसे चला गया. Even now in my family, I tend to hear from the patients also that so and so was admitted, but the doctor went on a leave next day. Why did they admit the patient? They did not care about the patient, but the doctor had prior plans. Can they always cancel their plans for a patient? No. But in dermatology, I tend to tell my patients 1 month down the line or even 2 weeks down the line, I am not on these dates. Please don't schedule your follow up. You can come later. Patients also are happy if you tell them in advance. They will plan their visits accordingly. So you can take as many holidays as you want without losing patients, without bothering for sick patients, without having anyone question why you are taking holidays. That's a very, very important point for those who want a balanced life, because this actually becomes a problem later in life. And since most of us work in our clinics, there is no boss on top of us. There is no one from whom we have to take holidays. We plan our holidays, we decide our holidays, and we work according to ourselves. So we are basically our own boss. We are the queen of the clinics. When you're working in a corporate setup, which is the case with most of the other core clinical branches, you have patients who are admitted, you have bosses on your head, you have seniors on your head, you have to ask for holidays. You cannot always do it according to your plan. So that's a very, very, major thing, if you ask me, which you should consider. Plus, as I already told you, highly paying, very highly paying. Once your clinic picks up, there is no limit to what you can earn. Now, these were the points why you should take dermatology. You should also know why not to take dermatology, especially the ones who are undecided, who are looking at the pros and cons. See, if you have passion, you want a branch, you don't look at the cons. But if you are someone who is in the phase of deciding, I would say more important than why you should take a branch is why you should not take a branch. Because when you don't like something, it is difficult to live with the negatives. Positives to theek hai, अच्छे हैं. Everyone can live with positives in life, but it is difficult to live with the negatives. So you should know the negatives before you make that choice. First of all, it does not have the thrill of core clinical branches. You are someone who likes to run around during your internship, look at sick patients, take their BP, their pulses, auscultate with a stent around your neck. You love that thrill. You want to be a life-saving doctor. You want to be an ICU doctor. You want to be an emergency specialist. who like the high octane, adrenaline rich rush, you are amongst those. Then derma is not for you. It's a very thanda branch. As I've repeatedly told you, there is no life saving happening here. There is no thrill, I would say, other than a visual diagnosis. There is no thrill. It's a very chill life. When I talked to someone who was about to pick up dermatology, this is a last week, a student called me to ask why you should pick up dermatology. When I told them there is no thrill, it is very thanda, it is very chill, he said, "Oh, ma'am, that's what I want in life. That's why I want to, think of dermatology. And now that you've told me, I'm picking up dermatology." So everyone has their wants, but I'll tell you, if you're someone who wants the thrill, then derma is not for you. This is the new branch for many. Many of you don't even know what to look for in a skin. What's a lesion? How does it look like? What is a red lesion? What's a brown lesion? What is a scale? What's a crust? Because a lot of us have not gone to dermatology during MBBS, so you don't know what it is. It can sometimes take a very long time to adjust to this branch. Core clinics, you've still studied, you've gone to postings, you know what it is. But in branches like dermatology, radiology, where you don't have much exposure, it can get very difficult to adjust, sometimes setting a negative tone for you during the branch. Academically, very intensive. Of course, it's a medical branch. Huge books, thick books, many books, and you are expected to know all of them because you don't have anything to substitute for you. In medicine surgery, if you know how to diagnose a patient, if you know how to cut, you're excused. But here, since there is not much to assess you upon, you have to know the theory. So academically, very, very, very intensive. You have to love reading, you have to love studying if you're picking up dermatology. A lot of things that you need for private practice are not covered during residency, especially if you're doing MD from government medical colleges or even private medical colleges. Aesthetic dermatology is not so much of a part. This is something that is covered well in the DNB because they are generally in the private corporate hospitals. So there you do have aesthetic dermatology. But if you have done MD, you'll have to learn all of this through the fellowships later in life. Social media is a boon as well as a bane for dermatology. You see a lot of dermatologists becoming influencers, they are making all types of reels. And okay, you can sing, you can dance, you can do whatever, but you don't have to tell treatments. There are a lot of us who are telling a treatment, okay, you have dandruff, use this, you have acne, use this, hair fall, this. Psoriasis, okay, this, uh, lichen pain, okay, this. So you are actually telling treatments online. Why will a patient come to you? Using a cream or a antihistamine doesn't do harm to the patient. They will definitely try it before they come to you. So that actually cuts down a lot of patients for you. And when a patient comes to you, they say, I've already used this, I've already used this, then you are at a lack of options what to give to the patient. So social media, okay, boon, it gets you patients, but it is also a very big bane. So if you are somebody who's not comfortable with social media, who may not use it for branding or, just that it can be negative, then a lot of students have asked me, what should be the role of artificial intelligence in future? Is that going to impact jobs in dermatology? Should it really decide for someone if they want to pick up dermatology as a career? Because as we see across the non-medical jobs, across corporates, across IT, AI is cutting jobs like anything. So is that a risk in medicine, especially a branch like dermatology, which is a visual branch? Everything is possible to diagnose based upon the picture of the lesion. You can refine AI to pick up the nuances based upon images. I told you it's a visual branch. 99% of the patients I can diagnose looking at them. So can't AI do it? You just put a picture of your lesion on Google. Google will tell you the diagnosis. What about those apps which are specifically working with AI in dermatology? So yes, AI will come big time in dermatology in the future, but it will take very long, or maybe it will not happen that will cut down jobs. Yes, it may take away a few patients from you. Yes, it may be the first line of consultation as a triage, basically, and then the patient comes to you from those AI apps. So, all that can happen. This is a separate topic on its own. I am not covering it, I'm just touching upon it, that yes, AI is definitely more risky in dermatology and radiology, which are image based branches. But will they take away jobs? not in the next 10 years or 15 years. So if you're planning in picking up dermatology, you can easily pick, you don't have to worry about AI. But if still this is a concern for you, you should consider it. Then it is difficult to navigate post residency. You are on road, there are no jobs waiting for you, there is a shortage of government or teaching jobs. When I finished my MD, I didn't get a senior residency for 6 months. After that, I intermittently worked in certain chains, or you can work with a senior dermatologist. But at my time, it was very, very difficult to get into senior residency. That was considered as difficult as maybe clearing an exam. Seats were so short. Now it has slightly improved, but still there is a shortage of jobs once you finish residency. Teaching jobs, government jobs come once in many years. Generally, people don't tend to wait for them. You do have corporate jobs, but there is no fixed pay in corporate jobs. They don't give you a salary like they give to the core clinicals, because there are inpatients. Major earning of a hospital is from patients who are admitted. Dermatologists don't admit patients. So for a corporate, they are not of much use. They will tend to keep you as a part-time, come for morning OPD, come for afternoon OPD, or maybe a full-time, come for morning, afternoon, look at the referrals, but they will not give you fixed pay. It will generally be on a sharing basis. This will generally be on a sharing basis. You picked up dermatology thinking about the glamour, thinking about the earning potential, but once you come into the market, you are getting jobs which are not even paying you 1 lakh. Because if you join a corporate setup, you build your practice, it will take a long time before you reach 1 lakh on a sharing basis. So you will be like, what is this? All my friends who are in the core clinics, they are earning 2.5, 3 lakh as a fixed pay once they exit their residency. What am I getting? That's a genuine problem in dermatology, and I want to talk about it. I want you to know the reality before you make the choice. For some of those who are in transferable, their spouses are transferable jobs, or they're still studying, you don't know where to settle. Many a times you will not get a job that pays you. Yes, there may be some aesthetic clinics in your city. They may give you a part-time or a full-time job depending upon the hours. There, the money depends upon the hours you're given. This can vary from 50,000 a month to about 2 lakh a month. But again, that's not the glamour, that's not the money that you had imagined when you entered dermatology. Okay, so this is something you should know. Jobs no jobs which will give you a fixed amount of money for your life. Aesthetic clinics very easily replace you. Corporate hospitals, it takes time to build a practice. Work with a senior dermatologist under them for 6 months, 1 year to learn the skills. They give you just about 1 lakh to 1.5 lakh a month. So that is the average that you earn in the metros. You should be knowing it. You don't suddenly start earning 3 lakh, 4 lakh, 5 lakh a month. That does not happen. I'm retaliating because this is a very important point. You tend to pick up thinking, okay, I will start earning this much from day one. No, that doesn't happen. Many a times when there are no jobs, private clinic is the only option for many. And when you are sitting in a private clinic, you need to have a lot of skills. You need to have a lot of confidence in you to pick up that clinic. First of all, you need space. Not everyone has a space. Yes, many a times you will hear from a lot of people, all you need is a room, table, chair to start a clinic. But do you have that room? Do you have that money to buy it? Do you have money to rent it? Do you have those pockets to take the brunt? So that is a very important point in dermatology. So, many a times you have to do senior residency, you have to work with senior dermatologists just to make a corpus. Once you make that corpus, then you get the money to give rent for your clinic. Then you get the money to start something on your own. So you don't have money flowing in from day one. That's very important. You need to buy machines, lasers, equipments. Yes, that can come with time. You earn a bit, you buy a machine, you earn a little more, you buy a second machine. So you don't need all of this in the beginning, but you still need to invest lakhs and lakhs of money in setting up a dermatology clinic. An average laser comes from, uh, you know, 5 lakh Chinese machines to 30 lakh American or Korean machines. You want to be somewhere in the middle, you want 5 machines in your clinic, you need to have 50 lakhs ready to buy that. Yes, you can do a stepwise purchase, but this is the amount that you have to invest. So, whatever you are earning, you have to invest along with that to set up the clinic. And this is just the cost of the machines, the cost of the space, the staff, the bills, all that you have to manage. So you have to have the pockets, you have to have the family support, or you have to make the corpus, or your spouse has to support for you to be able to set up that clinic. You have to have a business mindset. Running a dermatology clinic is not ke doctor bed गए काम चल जाएगा. No, you have to be clinic. It is a pure, any and every private clinic for that matter, not just derma, whatever branch you take, but it's a business. You have to know how to run a business venture, which is unfortunately not taught in MBBS and MD. So you have to be learning that, building that up to have a successful clinic. Once you have it, sky is the limit. Money is not a concern. It takes 2 years, it takes 5 years, sometimes it can take more. But once you build the trust, once your word of mouth spreads, once everyone knows you are a good doctor, then you don't have to worry. But you have to reach that point. You have to know that you are capable of reaching that point. Can you? Many a times, a lot of students have left dermatology because they think they cannot do all this just after MD. You sometimes don't have the resources. Sometimes you want a stable income. Your family needs, or you needs, or you have different wants in life. So you have to know this before you pick up dermatology. Then in your clinic, you have a lot of competition from quacks. Every homeopath, every Ayurved, every local Bengali doctor, depending upon whether you are in metros or tier 2, tier 3 cities, they all are dermatologists in their own right. Every chemist in your neighborhood is a dermatologist in their own right. So you have to actually, know that these are all people who are taking away your patients. Eventually, patient will come to you because none of them will be able to treat the patient properly. But they too eat up your patients. They tend to take your patients. Then nowadays, salons have so-called aestheticians. I told you, Chinese machines flooding all of the market. You get lasers as low as 2 lakh or maybe 1 lakh, poor quality machines. But they put it in their salons, they put it there, they start doing it on the patients. They don't charge much, patients don't bother. So these are people who are again eating up a large chunk of your procedures by doing this. Yes, clinical dermatology, no one can compete with you, but procedural dermatology, especially aesthetic dermatology, you have to compete with all of them. You have to compete with dentists. You see so many boards of dentists all around you. You will see teeth, gums, skin, hair lasers written on their boards. So when it is written on their boards, they advertise themselves as skin specialist. Patient goes to them for the tooth, they will see things on their face, they will say, okay, I will treat it. Patient doesn't bother, it's all about money. They charge less, patients will get it done. Non-derma MDs doing your work. I hate it. A lot of you who might be wanting to take plastic surgery, I hate it when I get to know that there are plastic surgeons in the area who are removing skin tags. There are plastic surgeons in the area who are doing laser hair reduction, who are doing scar management. Okay, that's their domain. But is laser hair reduction their domain? Is removing skin tags their domain? Not really. Please leave it for us. And these are still plastic surgeons. Okay, there is still some overlap between dermatology and plastic surgery. There are gynecologists who have opened aesthetic chains. There are people from all branches who are fed up of their clinical work, and they're thinking, okay, let's open an aesthetic clinic and let's just do a short-term 6-month fellowship in lasers and start doing it. See, the machine is doing most of the work. So there are non-derma MDs also who are eating up your job. And patient satisfaction may or may not happen. That can be there in all branches. But these are all the points that you have to know in dermatology. Now, after looking at the pros and cons, what is it that makes you decide? So I've told you pros, I've told you cons. What is it that should finally help you decide. My link is gone. Let me just open the link. So, what is it that should finally make you decide what to do and why to take up dermatology? First of all, you have to have the likeness and the passion for the branch. You have to want to be a dermatologist. And if you don't belong in that category, then you have to introspect. You have to know yourself. What kind of a person are you? You want a chill life? You want a stress free life? You don't want night calls? You don't want early morning surgeries? You don't want patients calling you all the time? If you are amongst those who like to sleep, who like fixed working hours, then maybe this is a branch for you. So you have to tautolify, you have to introspect yourself. You want a clinical branch, but you don't want a demanding clinical branch. When we look at clinical branches, it is derma and psyche, which generally fall in the low demand branches. These are chill branches as compared to others. So if you want this, then you have to know. Then maybe you can pick up dermatology. But who makes the decision for you? First, you have to know yourself. Second, you have to introspect. Third, you have to talk to people around you. But don't go talking to PGs and SRs in your college. Even those people don't know what the life outside is. You have to talk to the dermatologist around you. Go to their clinics. Look at the kind of work that's happening. Look at the patients coming in and going. And don't just go to one clinic, go to many clinics. Talk to them. Someone might be happy in their life, they will give you a positive outlook. Someone might not be so happy with their work or their clinic, they may give you a negative output. So don't talk to just one person, talk to many people around you, take an informed decision, and this is what will help you. Okay? This is what is going to help you. Any other doubts that someone has about picking up dermatology? Because these were the pros and cons of picking it up. So once we've covered the pros, we've covered the cons, we now move to the next step where you actually, come to this decision of taking. So think of it, make an informed choice, and then move forward. Now, once you decide, you come to the counseling. You are picking up dermatology. What to choose? Some of you might be getting MD. There you have to decide what kind of a college you take. You take a government college. In that, you take a government college in the metros near your hometown, or you take it in the periphery if that's your hometown. Or what government college should you choose if you're not getting a government college? What private college? What do you do? So basically, first thing that you decide is the branch. If you are hell bent on doing dermatology, then you see what you're getting. You're getting MD, then you decide colleges. Or you're getting DNB, then you decide colleges. Or you're getting a diploma. So what do you do is your passion. So your branch you are decided, you're getting MD, good enough, academically superior, tends to be in medical colleges where you have full departments, you have people who are there for teaching, so they like to teach. Research tends to happen in medical colleges. You can get into research. Internationally recognized, internationally equivalent. You can get jobs in, Middle East. You can apply for USMLE. There also they may consider that you've done dermatology. You may go to Australia, you may go to certain other countries. They do recognize if you have MD dermatology from a recognized institute. If you are not getting MD, the next is DNB. I wouldn't say that you change the branch just because you're getting DNB. Here we have already decided that you are doing derma. So I'm not going into MD dermatology versus DNB में कुछ मिल रहा है. No, we are not there. We are beyond that. So we are at a point where we have discussed that we are doing dermatology. You're getting MD, good enough. You're not getting MD, take DNB. Generally, in good corporate hospitals, you get it. in the metros or maybe in tier 2 cities, it is equivalent if it's a good institute. They have high caseload, they have good procedures, they have good machines. It is good, especially for someone who is sure that they have to go for private practice. Sometimes DNB works out even better than MD because you are actually doing the work which you will do later in your life. So you are learning what is required rather than being in a medical college, not knowing everything, going out, learning. So, sometimes for that, for a private practice, DNB is better. Diploma, अब है ही कोई जिसको डर्मा ही करना है, they don't have any other option in life. They have to do dermatology either for their passion or there is someone in the family whose clinic they have to join. They don't have any other option. Better not to waste time. You should be taking it up. You can do a secondary DNB, you can upgrade your degree, but overall diploma being a shorter course, being a 2-year course, is okay for someone who has to take derma. Other than that, MD and DNB will always be preferred over it. Now, once you have seen whether you're doing MD, DNB or diploma, now you come to that point where you have to choose between a government college and a private college. Government colleges will obviously be preferred. Obviously, there is generally a strong clinical exposure, there are good academics, the fees is not so much. So, government will always be preferred. But for some of those who don't have that option, you have to go for a private medical college. I would say if you like the branch enough, you have the resources to pay the fees, you can take it because the branch will give it back to you in due course of time. It will give it all back. You don't have to worry about money if you are very passionate for a branch. It will, if you are passionate, you will do well, you will earn well, you will get back all the money. The only problem with private colleges is the high fees. Sometimes departments are not very populated, so you may not have a lot of teaching happening. The caseloads may not be high. You tend to have a lower OPD, especially in those colleges which are not well managed. But there are a lot of good private colleges also. We can look at the college and decide what we want to do. Then many of them may have modern equipments, many may not have, but most important determinant is the cost. If the cost is not much of an issue for you, don't compromise on the branch. Now, how do you compare colleges for dermatology? First of all, if you have to pick up the choices, look at the OPD volume. Ours is an OPD heavy branch. At hospitals, at your clinics later in life, it is going to be OPD heavy. So when you choose a college or when you are deciding between colleges, look at their OPD volumes, go to the college, talk to the PGs, SRs. What kind of patients do you see? 100, 200, 300. Like when I was in UCMS, we used to see a close to 900 to 1000 patients a day. This is 2012 to 15 that I'm telling you. That was a very high caseload for that. But in 2015, when I went to Maulana Azad Medical College, we had a daily OPD of 1200 to 1500 patients a day. That was the kind of exposure that we had. And more the number of patients, the rarer diseases also come in, the more severe diseases come in. You tend to diagnose a variety of diseases. That's a good point for you. But at least more than 100 patients is a bare minimum. You cannot go to a college which has a lower OPD than that. Then having an inpatient fertility is good, facility is good. That means there are patients in the OPD, some of them might need to be admitted. You may see the rarer diseases like pemphigus or psoriatic erythroderma or more severe drug eruptions in the inpatients. So that's a good point to have. Then look at the procedures that they are doing. If they are doing the traditional procedures, they have the availability of lasers, dermatoscopes, phototherapy. That's all a very plus, plus, plus when you are choosing a college. Then what is the kind of faculty over there? Are they staying throughout their times? Are they interested in teachings? Are they holding academic activities? Look at that. When there are academics, you tend to get more interested, you tend to learn, and that learning stays with you for life. So academically focused colleges are quite a good option. Then look at the language. I would say that's a very important point. As I told you, patient interaction is supreme here. The language is important. If you are getting a college near your hometown, where you have your own language, you can talk in that, you will end up learning more. You will, be more satisfied with your branch. But if you are in a distant college where language is a barrier, it might be an issue. It might change your outlook in the branch. Then colleges in the metro tend to have more cases. They tend to have more procedures. Tier 2, Tier 3 may give you more rarer cases often. So these are all points that you have to consider. But how do you actually choose a college? First of all, it's your rank, what it is giving you. Then if a private college is coming, budget is a very important consideration. I have had students message me, ma'am, I really want to be a dermatologist, but the college that I'm getting is a private college. I will need about 50 lakh fees an annum for it. What do I do? I can't afford that kind of fees, or maybe 50 lakh in 3 years also, but I can't afford it. I'll have to take a loan. Is it worth it? I would say if you're really passionate for the branch, it is worth it. But if you're not sure and taking a loan and paying that loan is difficult, you have family obligations, you will not get a fixed pay after MD. In those situations, it is very important to consider this as a star criterion, especially if you are not sure. Okay? Please keep that in mind. Don't make a mistake just because you want to follow the herd mentality. No, be mindful of your priorities in life. Region, very important, especially due to language barriers. What is your goal? What have you decided for yourself? You want an academic branch? Okay, dermatology is beautifully academic. You want to go into cosmetic or aesthetic dermatology? A lot of options. You want to be a pure clinical? A lot of options. But which college is giving you what predominantly? You can choose a college based upon that. You want to go to academics? You choose a state government medical college. You choose one of the new aims. You want a cosmetic? As I told you, maybe doing a DNB might be better than MD. Or you want to be a pure clinical dermatologist, again, choosing a college with good caseload will give you the required exposure. So you have to know your career goals that helps you in choosing the college. What are your priorities? Again, location, language, stipend can be a very important factor because stipend varies like anything across the country. So if you are in need of money, you may end up choosing a college which gives you more stipend, provided they are equivalent. Okay, so these are all the points. Then bond, again, a very important factor. Try to go for a college which does not have a bond. But if you don't have an option, look for lesser bond times, look for lesser money in the bond. So all of these are points that you should consider. No, this is not a pre-recorded session. Is it worth taking a loan of 45 to 50 lakh? See, you have to take the branch. I've said this many a times throughout the session that your branch will give you back every penny if you do well in the branch, and you will do well in the branch if you are genuinely passionate about it. You will end up becoming successful. So you take a loan, you do it when you know you can do it. But if you are unsure, then I would want you to think twice before you take the loan. Now, is the loan worth? This was the question that I answered in the chat as well as here. Stipend or bond duration important? Definitely. Some colleges, the bond may change over time. You may think while picking up that, okay, fine, I'll pay the amount and I'll, release myself. But what if 3 years down the line, they increase the bond amount? And there is always, some gray areas. They may or may not agree that you joined before. It does not apply to you. No, so always try to choose colleges which have no bond or less bond. Stipend, not the most important factor, but for some, it may be like if I am from Delhi, I anyway had to choose Delhi colleges only. But when I joined PG Dermatology, the stipend in Delhi colleges was 60,000 an annum. Now it is 1.25 lakh, 60,000 a month. Now it is 1.25 lakh a month. Similarly, in Mumbai, my counterparts were earning just about 20,000 a month or 25,000 a month. Plus, there was a bond for Maharashtra colleges. So, I am from Delhi. I made the choice of doing it from Delhi. But for someone who has to make a choice, please see what is the stipend, what is the bond. Shimla, radiology, a friend of mine took, but there was a bond in Shimla. She could have, she was not getting any other college. She wanted radiology. She had to take up Shimla. Even, the bond, she worked during that bond period. So it depends where you are getting, what you are getting, what's the stipend, what's the bond. Please look at all that. Then what are the lasers available in that hospital? What's the patient load? If you have to choose between them, I would say patient load is supreme, because when you have more patients, you learn clinical skills. That is more relevant. Lasers you can learn later also, but clinical skills you only and only learn during your residency. You hone them over time, but learning happens only during residency. So patient load any day over the equipments. If you are someone who wants to go abroad for a job, or who has this in mind, then I would say for jobs in the Gulf or the Middle East, this is a very good option. But if you are considering MLE, or you are considering MRCP, then dermatology may not be a very good option for you. Because then the degree is not recognized. There are lesser jobs in those countries also. I'm getting a question. Will my skills be good at periphery? How to get improved in SRship at GMC? सीखने वाले सब सीख लेते हैं. Everyone who wants to learn can learn in time. So don't worry about honing your clinical skills. You will learn. You do residency at whatever college you are getting. If your branch is decided, you do your residency at whatever college you are getting. Try for senior residency in a government medical college, because that will teach you whatever you need to know. Okay, so don't change your branch just because whether you're getting it periphery or you're getting it somewhere. You can always top it up with senior residency. Need for fellowships is not absolute. It's completely your choice. No patient is going to come to you just because you've done fellowships. It's your choice. You want to hone your skill, you want to learn more, you do it, but it is not necessary. Risk of artificial intelligence, I've already told you, it will not take up your jobs. It will take up some patients, definitely, but it will not be a very major risk in the near future. Then these are some colleges which you can pick up for your dermatology. They are ranked 1 to 20. Obviously, AIMS Delhi, PGI Chandigarh, CMC Vellore, JIPMER Puducherry, these are amongst the top. These are premier institutes. These are the top colleges that you have. Then in Delhi, Maulana Azad, Manipal, look at this. Despite being a private colleges, this is on top because it is academically supreme. A beautiful college to learn academics. So I would not say that always go for a government medical college. Some private colleges also teach well. Then you have JSS Mysuru, LHMC Delhi, KEM Mumbai, RML Delhi. These are all good colleges. UCMS in Delhi. These are all like, I know personally, I've seen the academics. These are all good. Then, depending upon your region in the country, you can make a choice. You may not take top 20 in the country. You may want to go for the top college in your state. You want to live in your state, good enough. Yeah, you want to stay close to your family, good enough. Please don't look for top colleges in the country. You look for college which is a good college even in your state if you want to stay nearby. So don't fall into that trap. Look at everything, then make a choice for yourself, because ultimately life is a matter of choices, and every choice you make makes you. When I entered MD dermatology, I was very confused about whether I should do derma, I should not do derma. I even left it in two counselings and finally took it in the third counseling. So it was a very difficult first month in dermatology for me. At that time, my head of the department, Dr. Bhattacharya, a superb mentor. I am what I am because of those people. UCMS Delhi was amongst the best colleges academically at that time, and it still is. So my HOD told me, for every choice that you make, it's a choice because there are some options that you leave behind. You make a choice when you have options. Otherwise, you wouldn't have to make a choice. You will pick what you get. You make a choice because you have options. And when you pick this up, you leave the others behind. So when you make a choice, you have to be ready to leave the others behind. And this choice that you make is what makes you. Every day, the choices that you make are important. And this is like amongst the most important choices. Next to marrying your partner, I think this is the most important choice that you will make in your life. What branch to pursue. And once you enter into it, you have to make the rest of your life the best of your life. Then there have to be no regrets, there have to be no looking behinds, there have to be no changes that have to come into your mind. You have to strive to make it the best possible branch for you, be as successful as you can. That is very, very, very important. Any other doubts that you have before the counseling regarding dermatology, regarding other subjects, regarding anything, then you can always get back to me. This is my Instagram account. I've been asked, how is it in the top 20 colleges? Deemed college, 40 lakh fees a year. See, even Manipal is a very expensive college. Even Amrita is a very expensive college, but they are in the top colleges just because of their caseload, because of their faculties who are teaching there, who are the kind of thesis, the publications. There are multiple factors that are actually involved in ranking of colleges. So just because it's a government college or a private college does not always decide the ranking of the college. It is decided by their caseload, by their publications, by the number of PGs, by the success of the faculty in terms of their research abilities, the number of beds that they have. So these are all factors that rank the college. You may or may not go to the colleges according to their rank. You do it according to what you are getting, what is your preferred area, your language, all the other factors that should be deciding the college for you, not the ranking, I would say, not the ranking. Okay. So with this was about picking up dermatology in your counseling. Any other doubts, always get back to me. We at DocTutorials are more than happy to be with you till the end of your journey. So this is still a part of your journey. Any doubt, you can always get back to us. Thank you. Have a good time choosing your colleges. May you all get what you want in life, and may you all be very successful at what you intend to do. Thank you. All the best. Good night.